Thank you all for coming. I want to begin this evening by acknowledging the anxiety everyone is feeling. I personally feel it, and I know all of you do too. The COVID-19 outbreak is a very serious event. My board colleagues and I, along with every elected official in Santa Barbara County, are fully committed to doing everything we can to adapt to this rapidly changing environment. I want to ensure everyone that the thousands of women and men who work for the County of Santa Barbara are dedicated to serving, protecting, and caring for our community during this difficult time. Right now, our Public Works Department is hard at work in the foothill debris basins to prevent flooding from the storm runoff in our urban creeks. Our firefighters and deputy sheriffs are responding to calls for service. Like our firefighters who run toward the flames in a wildfire, and our law enforcement officers who risk their lives to protect us, our public health team and their local colleagues are not flinching from their work to respond to this virus. As conditions are changing, our public health department will continue to use every available tool to minimize the impact of coronavirus on our community. I also want to thank the many folks in our local service sector who have stepped up during this crisis. Our local grocery store clerks, pharmacists, janitors, and all the other people who are taking extra steps to help the public during this time. We all have a role to play in our day-to-day actions as well. We must practice social distancing and healthy habits while also looking out for one another. It is easy to be overwhelmed by all the information that's circulating at this time, but I urge everyone to continue to heed the recommendations and mandates that are released by our local public health department. As a reminder, the county public health website is publichealthsbc.org, publichealthsbc.org. You may also reach the operators of the call center directly at 833-688-5551. That's 833-688-5551. This is the critical information we want everyone to remember. If you're an older person, stay home and away from other people. If you are a person with serious underlying health conditions that can put you at increased risk, stay home and away from other people. Even if you are young or otherwise healthy, you are at risk, and your activities can increase the risk for others. It is critical that you do your part to stop the spread of the coronavirus. Our county departments have prepared plans to ensure continued operations of our government during a pandemic. We have already begun social distancing, holding online meetings, changing our procedures to allow the public to interact with us online, via mail or by phone, and giving employees flexibility to telecommute. People depend on certain essential government services for public health and safety, as well as safety net services, and we are committed to continuing to serve our community members through this pandemic. Today, our public health professionals will be providing critical information about testing capacity, updated testing criteria, and the process for COVID-19 testing in Santa Barbara County. You may notice that our press conference is again a little bit different than what we've done in the past. We have our health officer, Dr. Anzorg, on Skype, and here at the press conference itself, we're ensuring that all participants and media are 6 feet apart to achieve social distancing. As we've done in other challenging times, our community will continue to unite to take care of each other, to prevent the spread of the virus, and help those in need. To specifically discuss the actions Santa Barbara County Health and the county is taking today to ensure the safety of our community, I'd like to introduce Dr. Vaughn Del Reynoso, our Director of Public Health.
Thank you, Supervisor Hart. I appreciate your reminder for our community to practice social distancing, because we are essentially vectors and we do have the power to mitigate and to slow the progression of COVID-19 in our community. I'd like to start with an update. As many of you may have heard, we have quarantined 5 residents in Isla Vista, and we are monitoring their progress, their health status, and we now have 1 confirmed case of COVID-19 in North County. So what I've been hearing as public health director is a lot of concerns in the community about community transmissions, fears about how do I know if I've been exposed, how do I go get testing, and so tonight our team is here to give you some of those answers. We have with us tonight Ms. Paige Batson. She is the Community Health Deputy Director. She will be going over how COVID-19 is transmitted, what do we do when we get a case, how we investigate. Dr. Ann Sorg will be joining us by phone, and he will discuss our community agreement about testing criteria. And Dr. Stuart Comer, our medical director for our public health lab, will talk about the testing capacity in our county. So with that, I'd like to invite Ms. Batson to share.
Thank you, Vaughn. Okay, so as Vaughn mentioned, we in Santa Barbara County do have 1 case, a confirmed case, and I want to remind our community who's very concerned about this particular case that we believe has been a community-acquired case. We have conducted a very thorough investigation with this individual, and we have several in quarantine in our northern in Santa Maria as well. We are also working very closely with our neighbor, San Luis Obispo County. They also have cases, and it's important to remember that so many of Santa Barbara individuals and San Luis Obispo, it's just a walk in the park, and so they cross borders all the time. And so we are working very closely with them to conduct our contact investigation, and we are together we are identifying those individuals at risk and or that have had significant exposure, and we are ensuring that they are quarantined as needed. So I think people are very concerned. They're wondering, how would I know if I'm exposed? And I think we need to get back to basics. We need to recognize that the virus is transmitted via droplet, unlike other airborne diseases such as measles and tuberculosis that don't weigh as much and they remain suspended in the air. And so whenever someone coughs, the droplet can typically only go 3 feet and travel 3 feet. And so what happens, that is one of the reasons we are encouraging social distancing, because if you stay away from someone who is coughing and the droplet can only go 3 feet, then it is unlikely that you would inhale an infectious droplet or potentially be touching surfaces. Touching surfaces is another way. We all know that the virus can live anywhere from a few hours to days, depending on if it's in the right environment. Hence why it's so important for individuals to ensure that we're disinfecting surfaces, doorknobs, etc., and ensuring that we are not touching our face, our eyes, nose, and mouth, because this virus survives in mucous membranes. And so, as a general rule, we are not going to get infected by casual contact. It's usually because of some exposure to the infectious droplet. And so with that, I will pass it to Dr. Comer.
Thank you very much. Thank you very much. I just want to provide some information on the testing capabilities in the county and reiterate what the supervisor has said in the deputy and director public health. I think it's important for you to realize that this really is a collaborative endeavor by not only the county of Santa Barbara, but also adjoining counties, both Ventura and San Luis Obispo, who have provided us support in the testing of this. So this is very much a Central Coast process. Currently, we have more than enough of the collection kits to be able to test the patients. This is very, very important because there are two elements to the overall process of laboratory testing. One is the collection kits that you actually take the swab and put it in a viral transport media, and then the second portion of that is how you test that. So at the present time, between public health, the cottage hospital system, and the private offices, there are over 1,700 testing kits collection kits for that. As far as testing, we again have several different options to utilize. We utilize the adjoining counties as well as the California Public Health, and also private laboratories, both Quest, LabCorp, ARUP, Mayo. So in terms of testing, there is really not a problem. The question that the director had pointed out is it's extremely important that we understand we really are focusing on symptomatic patients. That's really the focus of the testing. And in that context, we have more than enough capacity. It may take a day longer in some cases to get the results, but in terms of collection kits and in terms of testing kits, we do have sufficient capacity at the present time in order to support the current COVID process we have in Santa Barbara County.
Thank you, Dr. Comer. Dr. Ansorg, could you please share with us the healthcare community agreement about testing criteria?
Why don't you go ahead?
Okay. So while we wait for Dr. Ansorg to join us, I'd like to give an update about the number of tests that our county has done. So previously, we had, on our website and publicly, we had quoted a very small number. And we acknowledge that the number that's been quoted, the single-digit number, has been public health originated tests. And reaching out to the rest of our community as of date, so as of today at 2:40, we have the number of tests that our 4 hospitals and our public health has completed. And so the number of tests in our community that has been done is 128. Of that number, we have 31 negatives and 1 positive, and 96 pending. So that gives us a more complete picture of what's happening in our county. And this number, I want to say, is a little bit underreported because we are still waiting for data from 2 private labs and 1 hospital. So we will be updating our website with accurate numbers or enhanced numbers as they become available. Let me see. Technical difficulties.
Okay. Do you have additional information?
I do. I will share what Dr. Ansorg's message will be. So, understanding that we do have a limited number of tests, kits, and specimen kits in our county, the 5 hospitals as well as the community clinics have formed a work group to create a community criteria for how patients will be tested. So we created a tier 1, tier 2, and tier 3. And providers will be assessing their patients according to this criteria. And we have complete support from one another. We will go forth unified with this message, with this testing criteria.
Hi, this is Henning Alzoka. I'm sorry, I was jerked off that line. I don't know how, but I tried now through an internet Skype process.
Great. Well, welcome. I was just about to go into the Tier 1, Tier 2, and Tier 3. Would you like to take over?
Of course. So, unfortunately, we do not have as many test kits and testing supplies available as we would like, even though it is really ramping up daily and more labs are coming online and more test kits will be available as the week unfolds. Because of this shortage, we created a work group with our local hospitals, our local big and small providers, and created a priority tier system on which we agreed which patients are at the highest priority to receive a test like that. And we did that in conjunction with other counties in the state who have similar shortages of lab availability or lab test availability. And we decided that the most vulnerable or the people who might suffer the most from a critical condition are elderly folks, especially in senior residential facilities and nursing homes, in assisted living facilities and so forth. So if they become significantly ill with fever of over 101 and a cough, shortness of breath, pain with inspiration and so forth, they would be in our highest priority category. Then, in order to preserve our healthcare worker force, our doctors, nurses, radiologists, technicians, phlebotomists, CMAs, help us in the hospitals, EMS, ambulances, firefighters, first responders, all those are really critical, not just for the response to this epidemic or pandemic, but also for other ill people. So we want to know as quickly as possible if those people can continue to work or have to be isolated, and therefore we place them as well in this higher category, not because they're better people, but just because we really rely on their services. And thirdly, we discussed that people who are severely ill and hospitalized and until now have to be isolated in a negative pressure room, and we have limited amounts of negative pressure rooms, that we would want those test results fast-tracked as much as possible in order to be able to navigate, a potential shortage of negative pressure rooms. I do know from our state officials that it is in the pipeline that we may not require those negative pressure rooms necessarily, but it's not quite right for prime time. So we hope that we get some relief on that end. So those three categories: hospitalized patients who need a negative pressure room, elderly folks in assisted living or senior residential or nursing home facilities, as well as healthcare workers, we put in Tier 1. In Tier 2, we put severely ill people who would, where it will make a big difference if they are diagnosed early. And then the lowest category is really people who are very mildly ill, and actually it's not that essential because it wouldn't change the therapy. They would have to isolate until they are better and they are fever-free for 3 days, and it is basically only interesting from a perspective of the epidemiology and how many cases we have. But unfortunately, we would like to have everybody tested, but unfortunately, at the moment, we just cannot afford it. I'm looking forward to the next week or so, or 10 days, when we have a much better capability of and availability of testing. And I urge our people to please understand that this is not in our hands. There are nationwide, and there are actually global shortages of important ingredients in these test kits, in test swabs. Just imagine that, like, testings around the world all of a sudden are done in the millions, in the tens and hundreds of millions of cases, and the supply chain has been interrupted because a lot of these things are actually produced in China, and the federal government is working tirelessly on national production, not just on masks and gowns, but also on production at home here for these test kits. So in the very near future, we will have a much brighter view on this. So please bear with us. Until then, we have to, unfortunately, rely on such a tier system. So let me just check what else. Yes, I would like to just maybe discuss again what somebody should do if they think they might be infected. If you feel like you're coming down with sore throat, a cold, nasal congestion, a cough, a fever, any of these upper respiratory or lower respiratory symptoms, please, you consider yourself a potential case. I don't mean this in order to make people afraid, but just in order to take it seriously. Do not go to work. Do not mingle with people. Stay isolated and take care of yourself. Have lots of fluids and take some, Tylenol is the preferred medication if you have body aches and fevers, but be advised to take only the amount recommended by the manufacturer in order to prevent toxicities. If you feel you're getting sicker, do not hesitate to contact your healthcare provider. However, please call ahead. Be advised that your respirations, your cough, your sneeze, everything is highly contagious. So if you were to go out to see your doctor, for instance, please wear a mask to cover your respiration secretions. And then that's what I suggest. So we do have a hotline, as mentioned in the beginning. Feel free to call there, but I would urge you to call your primary care doctor. They are all really well informed now what to do and so forth. If you get sick to a degree that you feel short of breath, or you have pain with breathing, or you run a really high fever, you may have to be seen in the emergency room to get emergency care. Please, same thing. Be so kind and call ahead and advise the emergency room that you're coming and you have these symptoms and you might be coming down with this virus.
Thank you, Dr. Ansorg, for your detailed guidance. And I want to end our commentaries with acknowledging that our governor recently offered guidance regarding seniors age 55 and older to self-isolate, restaurants to reduce their capacity by 50%, and bars to be closed. We're supportive of our governor's efforts to slow the progression of COVID-19 in our state, and we urge our community to act in accordance. We are evaluating the situation here in Santa Barbara County on an hourly basis and have the capacity to amend our current health officer order for social distancing if needed. So with that, thank you, and I'll turn it over to Supervisor Hart.
Thank you for your attention. At this point, we'll answer questions from the media that's in the room, and then we'll move to questions for folks who are on the telephone. Delaney?
So for tiers 2 and 3, their directions are if they think that they have come down with the virus to contact their primary care provider, but what if they don't have insurance?
The question is for patients who are in tiers 2 and 3, the advice is for them to contact their primary care provider, but what should they do if they don't have insurance?
So, if we, the Santa Barbara County Healthcare Centers, we are the safety net healthcare provider for the county as well as our colleagues at neighborhood. So if our residents don't have insurance, they can get the support and the medical attention that they need at our county healthcare centers as well as at neighborhood.
Yes, please. I'll repeat the question so he can hear you.
Okay, awesome. I believe he had said, not during this press conference, but he said that if you don't have any symptoms whatsoever, but do have the virus, you are not able to transmit it. Is that the case? I just wanted to clarify.
The question for Dr. Ansorg is, if you don't have any symptoms present, can you still transmit the virus?
Our current understanding is that you only transmit the virus when you're symptomatic. Now, this could mean that you have extremely mild symptoms and you may not consider yourself being sick. You just have a raspy throat, or a little bit of the sniffles. You're going to be contagious at that stage. So I know it's a fine line, but if somebody is feeling completely fine, the likelihood of them to transmit this virus is extremely low.
Thank you.
Tracy?
A lot of people were sick in the fall with unusual things that kept lasting a long time, and I got a question just now saying, when can you return to work when you feel better? And is it possible that people in the winter, like November, December, we've had that extenuating illness and they weren't sure, is it possible that they have had coronavirus and are better now? And if you are better from self-isolation, when can you return to work?
Multi-part question. Is it possible that folks who were sick earlier in the year with unusual symptoms that persisted for a long time could have had coronavirus at that time and have since gotten better? And then the second part of the question is, if people are feeling symptoms, how long should they self-quarantine?
Dr. Ansorg?
Yes. If somebody had a respiratory virus earlier this year, it's almost impossible that it could have been this novel coronavirus because it originated in Wuhan, China in December. Unless somebody had traveled, but we did not have any spread to the United States until February or maybe late January. So there are so many different viruses out there that even the respiratory panel that checks for these viruses, or some of these viruses at the hospital, they list 20 different kinds of viruses that cause very similar symptoms. Those include 4 other kinds of coronaviruses that are much milder and do not, make people sick enough to need hospitalization. But they're well-known viruses that cause upper respiratory infection. And so if somebody were to be really unfortunate, they could have a RSV virus in November, influenza virus in December, a coronavirus from Holland in January, and para-influenza virus in February. That is sometimes the case with little kids because their immune system just gets exposed to a lot of different viruses, and adults less likely so. But it's a possibility if somebody would be really unfortunate.
And then the second part of the question was, if folks are experiencing symptoms and they self-quarantine, how long should they stay away from other people?
That's a a very important question, and we're discussing this on a daily basis with the state authorities, with CDC, and they actually came out with guidance today that because we cannot test everybody for this virus, we have to assume, for lack of testing results, that anybody with these kinds of infections could have the virus. So we ask everybody to stay home until they have no fever without taking Tylenol or anything to lower the fever for 3 days and feel without any symptoms, like weakness, muscle aches, fever, sore throat, cough, and so forth. Until the resolution of all the symptoms, they should wait an additional 72 hours before they go out. That is very much needed at the moment, even though you might think, oh, I'm well now, I can go back to work tomorrow. No, during this time, please do not. Please follow the guidance, even if you didn't have the test. Stay home until 72 hours of complete freedom of symptoms.
Are there additional questions here in the room?
Are we likely to get those drive-by swab type tests? We're getting a lot of video of that, and I know someone down in Ventura County in Camarillo was tested in a parking lot, and I know it came up where a doctor here had been concerned that he didn't have what it took to swab someone to protect his staff.
The question is, are we likely to have drive-in testing capabilities here in Santa Barbara County? There have been other communities on television that are utilizing that system. Is that something that we expect here in Santa Barbara County?
That's a great question. So I know that from our work group meeting today that there are 2 community healthcare partners who will be doing that. However, I want to clarify that drive-by testing is really not meant drive-by testing. So these are patients who have been screened and who meet medical criteria and who are scheduled. And so the collection of the samples will be done in a parking lot or an outside facility. By appointment, yes. And if I could make another clarification. So we talk a lot about limitations in the number of collection kits. I do want to really reiterate that, as Dr. Comer mentioned, we currently have 1,700 collection kits. So anyone that meets medical necessity, meets medical criteria, will be tested.
Thank you for that, Dr. Reynoso. Are there other questions? Yes, Tracy?
Is there a mathematical equation, since so many people are not being tested, that we can guesstimate a true number of how many people will eventually get the coronavirus? Because a lot of young healthy people obviously won't need the tier 1 or 2 or 3, but will stay home. So could we square root of something?
The question is there a way to extrapolate the number of people who will get the coronavirus in our county from the information that we have available today?
And I wish our epi person was here to be able to do some modeling for you, but I'm uncertain. So, Dr. Comer, do you have a guesstimate?
I think the answer to that is it's going to change significantly because of the new imposition of social distancing, et cetera. When they talk about flattening the curve, the difference to that now is we've altered the normal course of transmission from the containment to the mitigation stage. And I think the answer to your question is, as a consequence of these actions, and they're pretty significant actions by closing down a lot of different facilities, I think the reality to that is that it's going to be far less than what we might otherwise have expected had we not engaged in those particular activities. I just want to also reiterate that public health has done an exceptionally good job of working with all the partners of the 5 hospitals plus all of the private facilities in town. And I think that is extremely important because that's how we're doing this together. It's really a community involvement process. And because everyone's really affected, because it doesn't make any difference where the patient resides. In this regard, it's really the entire community. So I think that's an important point in going forward, is that this is really a community effort.
Are there beds available in all these 5 hospitals?
Yes, there are beds
The question,
available right now.
just a second, Dr. Comer, we'll have to repeat the question so
Oh, I'm
folks
sorry,
on the
yeah,
phone
please.
can hear that. The question is, are there beds available?
The answer to that is yes. And just so you know, I can speak for Cottage Health and also for Lompoc Valley. I mean, they've done a lot of work in expanding that in planning. I mean, what people don't realize is every day, I say at Cottage Health, all of the leadership is together planning for that. At the present time, we have the same census we had basically 3 weeks ago, 4 weeks ago. So we haven't seen that increase at the present time. It has been no different. And actually, most of what is driving that, interestingly enough, is actually the flu, not actually corona. So the point being is that everyone is planning for that possibility, and we will continue to do that. I mean, every day, all of these hospitals are actually planning for that eventuality. The worst case scenario is what everyone's working for, and our deepest hope is that we will not have to do that, but that's what everyone always plans for. But at present time, there's not a problem with bed shortages whatsoever.
Thank you, Dr. Cromer. Any other questions in the room? Yes, sir.
Are there more tests on the way, and why did it take so long for all the tests to get here?
The question is, are there more tests on the way, and why did it take so long for more tests to get here?
Great question, and I'll try to answer that as succinctly as I can. When it first started out, when you think about it, you have a very novel virus, and you have to go, how do I create a test that will actually detect that? So when it first came out, they sequenced it very quickly, and CDC was the first one to basically have the test. And then CDC basically created test kits that went out to other of the state and county throughout the United States, through the public health systems, through basically the Association of Public Health Laboratories. Unfortunately, what happened is some of those test kits did not have the appropriate quality, and therefore they were not willing to validate these tests because they would not have been accurate. So what basically has happened is once the task force has stood up nationally, they got private labs involved with also the public labs, and it's been that collaboration that has made the difference. We are now, as of 5 days ago, we have some major manufacturers that now have almost standalone large analyzers that can do this testing. So as Dr. Anzorg pointed out, we think that potentially within a week and a half to 2 weeks, once those analyzers are up and running, that the capacity will be so much faster than what we have now. Currently what we use is an older platform, extremely good, but it's not the high-end analyzers, and that's what has come out recently. So to answer your question, initially it was a problem with the first set of test kits that came out, but now there's not been a problem.
Any other, Tracy?
You mentioned that I think first responders were tier 2, and I think 2 doctors were on the news, I think in the West and the East, that had critical illnesses. How are you protecting those doctors, because they still are handling people going to the ER?
The question is, how are we protecting medical personnel from contracting coronavirus so that they're able to deliver services to patients in our county?
Dr. Anzorg?
Yes, we have protective gear that all healthcare workers who are in contact with potentially infectious individuals have to wear to protect themselves. Because this virus is transmitted through respiratory droplets, we have to protect ourselves by wearing a protective mask, protective eye shield, a gown, as well as gloves. We like to have the patient in an individual room by herself in order to, not expose other people. And with this protective gear, we feel comfortable in dealing with the patient. We are dealing with other contagious patients on a regular basis. For instance, tuberculosis patients, influenza patients, multiple other virus illnesses, where we protect ourselves in this way. And if we are utilizing the available protective gear appropriately, we can protect ourselves to a very high degree. Unfortunately, the protection is never 100%, so it will and it does happen that occasionally doctors, nurses, medical assistants, healthcare workers, phlebotomists fall ill. But it's usually because there was some kind of break in the sequence of how to put on this gear and how to get it off you without touching anything and then touching your face: your mouth, your nose, your eyes, and that's just critical. And we train the professionals on a regular basis. We have them mask, we fit the masks and so forth. We remind them all the time, and it's unfortunate that it's not 100%, but to a very high degree we can protect ourselves and the healthcare workers.
And the first step in that chain, as you mentioned earlier, is for a patient who is seeking medical assistance to call their doctor in advance before coming into the clinic or the doctor's office so that the appropriate precautions can take place. Are there other questions in the room? Dr. Dovernusa, you had a point too?
Yes, actually someone texted me with a question about the affordability of the test. And so to the best of our knowledge, it is very affordable because it is free. There is no cost sharing.
Thank you for that. Any other questions here in the room? We'll go to the phone then. Just please ask your question and we can hear you on the phone, so go right ahead. First person that'd like to ask a question?
Yeah, I'd like to follow back up on the Isla Vista quarantine. The 5 people, have those people been tested? And if so, when are the results expected?
Yes, the 5 individuals that are in quarantine have been tested, and we anticipate that we may be getting the results, if not by as early as tomorrow, the following day.
Is there another question on the phone?
I wanted to follow up with Dr. Ansor. You mentioned sore throat as a possible sign of the coronavirus, and that's the first that I've heard specifically sore throat. I hear the other respiratory stuff. So are people showing sore throat, or does it need to be in conjunction with a fever or be considered likely?
That's a very good question, and that's mind-boggling at times for the clinicians, because a sore throat can just be nothing, or it can develop into a more severe illness. This novel coronavirus has a very, very wide spectrum of how it presents. It can present with a very mild illness without any fever. In fact, at least half of cases do not have any fever. They may, at least not objectifiable fever. So that's usually the problem, that somebody has a mild illness and doesn't feel really sick and goes around and spreads the virus in the community. That's why we are so, at this point in the pandemic, that's why we are so concerned about social isolation. That's the tricky part of this, is that you never know if somebody with just a sore throat and maybe a tiny bit of discomfort or something could have the virus, yes. We call a sore throat, a runny nose, upper respiratory symptoms. We call like a deep-seated cough, lower respiratory symptoms. So the virus can start with upper respiratory symptoms and then develop into a bronchitis or a pneumonia, or not. It can just stay and the immune system gets it out of you again. But it's impossible to predict, and that's the tricky part. And that's why we take it so seriously, because as of with our experience, especially in Italy and in other European countries, and also in California, that more younger people fall quite ill with this. And initially, many of us, including myself, believe that it's just like a really bad cold, and only people with really weakened immune system and elderly folks and chronic underlying conditions end up becoming severely ill. But that is not the case anymore. It's possible that the virus did mutate, or maybe I was just mistaken. But it shows now that a high percentage of people that require hospitalization are actually otherwise healthy and younger folks as well. Not children, but middle-aged and younger people.
Are there other questions on the phone?
One more question in terms of grocery store workers and other retail workers that are obviously functional within our community. We're taking care of healthcare professionals, but what can be done, and can the county do anything to protect those workers?
Who'd like to answer that question? Ms. Batson?
Yes, this is Paige again. With respect to grocery workers and others that are working with the public, hand hygiene is essential, cleaning surfaces is essential, and if anybody's actively coughing, they should, or if a customer is actively coughing, they should at least encourage them to wear a mask. I realize it's not that we don't have masks readily available, but certainly employees, if they're ill, they should not be reporting to work.
Are there other questions on the telephone? Any other questions here in the room?
Any timeline for when you might do this again, this virtual conference?
We don't have anything scheduled in this format. Tomorrow morning at the Board of Supervisors meeting at 9 a.m., there will be a presentation on COVID-19. We'll be meeting both in Santa Barbara. Some of my colleagues will be, in Santa Maria, and some of us will be down here. So folks can tune in to Channel 20 at 9 a.m. tomorrow. We'll have some of the professionals here and CEO Miyasato to give additional information tomorrow morning at 9 a.m. If there are no more questions in the room, I just want to remind people again about the public health website to get coronavirus information is publichealthsbc.org, just all strung together, publichealthsbc.org. And then we also have a staffed call-in center for folks to ask questions directly. That number is 833-688-5551. 833-688-5551. Thank you all for coming today and sharing this information with the public. And tomorrow morning, there will be additional information at 9 a.m. Thank you.